there are a lot of different diseases that can impact the heart. I'm only going to talk about just a couple of them briefly, and I'm really focusing on some of the more common diseases. And the first one that I want to look at is coronary artery disease. Sometimes it's called coronary heart disease or just heart disease. The underlying condition that causes this is something called atherosclerosis. And atherosclerosis in general just means a condition wherein you get the formation of a plaque in the blood vessel. If you go on and take pathology with me later on, you're going to learn that there are different types of atherosclerosis, and in fact, your book uses the term atherosclerosis when it probably should be using another term, arteriolosclerosis. But if you want to go on to pathology, you can learn a lot more about this in a lot more, some students say excruciating detail. I think it's interesting detail. But for now, I'm just going to talk about it very briefly, in the sense that atherosclerosis simply means the accumulation of fat and sometimes calcium carbonate in the interior of a blood vessel. Usually it's an artery. So here we have a picture of a histological picture of a typical healthy artery. Here's the lumen in the inside of the artery. And you can see by comparison in this artery over here that's impacted by atherosclerosis that the lumen, and I'm outlining it right here, is much smaller in size. And that's because this whole region here is a plaque or a region of fat and calcium deposits that have accumulated along with cellular debris and other things in this region. And what that's done is it's filled up the lumen with these different things like fat, etc. And so the amount of room that's left for blood to travel through that blood vessel is much, much smaller. And again, the smaller the amount of area that I have to force a fluid through, the more energy it's going to take, the more friction I'm going to encounter, and the more difficult it's going to be for that heart muscle to continue to circulate blood through that blocked artery. There are a number of different risk factors for the development of atherosclerosis, which leads to the development of coronary artery disease. These 9 factors can fall into one of 2 categories. Some of the factors are unalterable. There's nothing you can do about them. You cannot change them. And some of them are alterable. They're modifiable, if you will. So let's look at the unmodifiable first. Boy, let me just start over on writing that. Okay. Unmodifiable. These, again, are conditions we can't change, one of which is gender. Males tend to be more likely to develop coronary artery diseases than female. Nothing you can do about that. Age, another thing we cannot modify. We all age with time, and the older you get, the more likely you are to have coronary artery disease. The last of the unmodifiable traits is your heredity. Some people inherit a genetic profile that makes them more susceptible to developing coronary artery disease. And again, there's nothing they can do about that. It's just the way things are. On the other hand, there are a number of traits that are modifiable. There are things you can do about these particular risk factors. Obesity is one. The more obese you are, the more likely you are to develop coronary artery disease. Obviously, you can alter obesity by losing weight. Diabetes is another. In particular, we're talking here mostly about type 2 diabetes being modifiable. With the loss of weight, you can actually reverse type 2 diabetes. You can also, with type 1 diabetes, through careful diet management, exercise, and medication, you can mitigate or reduce the effects of diabetes on the development of coronary artery disease. Smoking. No surprise there. We know smoking is linked with the development of coronary artery disease. You can modify that by stop smoking. Being inactive also contributes. So the way to modify that, start getting some exercise. Hypertension or high blood pressure is another one. High blood pressure can be corrected through diet, exercise, medication. and the relief of stress, which is also another modifiable trait, by the way. Stress is another one. Stress obviously contributes to the release of things like epinephrine and norepinephrine, and those elevate heart rate, they also elevate blood pressure. So if we can reduce stress in our life, we also reduce the risk of developing coronary artery disease. As I said before, coronary artery disease impacts the blood vessel. It principally impacts the innermost layer, or the endothelium of the blood vessel. We're going to learn shortly, when we start learning about blood vessels, that this endothelium is also sometimes called the tunica intima. And the condition of atherosclerosis occurs when we get what's called an atherosclerotic plaque, this guy right here, accumulate in that tunica intima. And again, that's made principally of lipids, calcium carbonate, cellular debris, macrophages, fibroblasts, all kinds of different chemicals, cells, and cellular debris that if you take pathology, you'll learn about in a lot more detail. A outcome of coronary artery disease is that people can develop a thrombus. Thrombus is another word for blood clot. You can imagine that if I have to force blood through such a tiny opening, it's going to be going through that opening at a slow pace. The slower blood flows, the more chance there is for it to clot. So it is not uncommon for people with a severe blockage, such as we see in this slide over here, to develop a thrombus. And that thrombus can obviously completely occlude or block off blood flow to that artery, which can be a very serious event. Sometimes that thrombus can dislodge from the location where it formed and move to some other location and then block an artery there. If it does that, if the thrombus detaches and moves to another location, it's called an embolus. This picture here shows you a region where we have narrowing of a coronary artery due to the development of an atherosclerotic plaque. So, what can be done about atherosclerotic plaques and these kinds of blockages that can develop? Well, you can fix the condition through a process called a stent. And that's usually delivered by a process, a related process called angioplasty. So let's look at these. Here's my blocked coronary artery. Here's the atherosclerotic plaque on either side. You can see the lumen is very reduced in size. So what a interventional radiologist will do is he or she will insert a tiny little catheter or tube, usually into the femoral artery. This is the artery in the leg. And then they feed that catheter, that tube, all the way up to the blocked artery. It's usually an artery in the heart. When they get to the location where the blockage is, inside of this catheter, here, the catheter is in blue here, he or she will insert a long structure at the end of which is a balloon. So there's a balloon right in here. And that balloon then gets pushed right into the region where the lumen is narrowed, and then they inflate the balloon, as you can see here. And what that does is it pushes the lumen back open again. Then they deflate the balloon and they remove the balloon, and then oftentimes they will, as a last step, they'll put in something called a stent, which is like a little metal tube made of surgical wire, and that little metal tube will hold open the walls, and the idea behind this is to prevent it from closing back down or collapsing back down. That metal structure is called the stent. So angioplasty is the part where we use the balloon to inflate or reopen the arterial lumen. The stent is the part where we then scaffold or reinforce the region so that it doesn't collapse and close back down again. I want to talk just in one slide over several other conditions that are common coronary diseases. Again, these are not all of them by any stretch of the imagination. I just picked a handful of really common ones. People oftentimes with coronary disease will develop a condition called ischemia. And ischemia simply means reduced oxygen to particular tissues. So when tissues become ischemic, they have reduced blood flow, and as a result of that reduced blood flow, they have reduced amounts of oxygen being delivered. And if the heart muscle itself becomes ischemic, we can develop a condition called angina pectoris. Angina pectoris literally means pain in the chest. Pectoris relates to chest, angina means pain. So this is chest pain. The chest pain is an indicator of underlying ischemia. When tissues are deprived of oxygen, when they're deprived of blood flow and thus deprived of oxygen, such as when they're ischemic, they will start to become injured, and they will secrete chemical messengers that stimulate those nociceptors you learned about in 201. Nociceptors are pain neurons that send pain stimulus to the brain to indicate tissue damage. Angina pectoris is oftentimes a risk factor or an indicator that a myocardial infarction could follow, or an MI. Myocardial infarction is basically the death of heart tissue due to severe ischemia. We often call it a heart attack. Okay, I think that's all we're going to do on diseases. Yep, that's it. Next up, we're going to start looking microscopically at the heart and physiologically see what it does to circulate blood throughout the body.